Hello, my name is Dr. Tyler Callison. Thank you so much for choosing to come to my talk today. I'm very honored to have your time for the next 25 minutes, and I think you'll get a lot out of what's going to be discussed here.
So today's topic is posture 101, and there's going to be a flare of Chinese medical theory or traditional Chinese medical theory, and I think that the perspective that we have using TCM gives posture and postural analysis a really interesting and unique perspective, and it also informs us on how we can treat posture. So let me ask you, what's the word you immediately think of after I say low back? Pain, right? Well, this slide may have given you a little bit of an idea, but why do we have such a strong connotation with pain and this very particular part of the body? Probably because we've all experienced it at least once. Even the young people who are listening to this video have most likely experienced it in their lifetimes. In fact, the CDC said that 25% of adults have reported low back pain in the last 3 months, and that it's the most common pain reported, period. So why is it so rampant? Well, there's many reasons. The low back or lumbar region of the body is so easily subject to postural changes. It is a region that supports the weight of the entire body and connects directly to the pelvis. It's really the keystone of our entire structure. You all know what a keystone is. So if there's an arch like we see here on this slide, the keystone is that one rock or stone that holds the entire structure in place. The hips are kind of in the middle of the body, where the upper torso rests on them and the legs branch out of them. It's the fulcrum point of which we move, of how we stand up and sit down, and that is the main reason why the pelvis is such an important thing to look at when we look at posture. This means that if the pelvis is off in some way, then the entire rest of the body is going to be off in another way. But we'll get more into the specifics of this later. First, let's talk about posture as a term. Posture is a common buzzword that gets thrown around. We often think of our parents saying, straighten your back and don't slouch. So what is posture then? I want you to think not only of a certain part of your body, but the entire thing being connected from head to toe. This is similar to how Chinese medicine views channels. Many of them, 3 on each leg in fact, connect from the toes to the head. Modern research, such as that of Tom Myers and Helene Langevin, have shown that fascial chains connect distant muscles of the body through a single fascial train. This can be an explanation of one of the mechanisms of acupuncture, as we can insert a needle on one end of the body and affect the opposite end. Fascial networks communicate. This is why posture is so important, because that hunched back could be affecting your hips, affecting your knees and your feet, all manifesting in, say, low back pain. A lot of times postural disparities are a result of modern life. You can see in this picture, this girl is working on the computer. I mean, that's a posture that we, at least most of us, assume and are probably assuming right now as we watch this video. So I'm going to present to you a couple of different postures. Really, it's all one and it's all connected and we see it very often, but it's a great example for learning. See if you can recognize this in yourself or family or friends. The hyperkyphotic curve and hyperlordotic curve. This is very common we see. Just to break it down a little bit, the upper back curves like an S. It's like the top half of the S. This is called kyphosis. Kyphosis is normal, so is lordosis. But what we're seeing is that the S looks a little more S-like. So the top of the back is actually stretched. These muscles are stretched long or locked long, and the front, the chest area, these muscles are locked short. Now, this term locked long and locked short, I'm going to be using this a lot because technically they're both tight, or they can present as tight, but one of them is stretched out like a rope that can't be stretched any longer. The other one is like if you take that same rope and you twist it, and it's actually shortened. It's both tight, but one of them is long and one of them is short. So on the bottom half, we see the lordotic curve. Lordosis is when it curves in. And so the low back is going to have locked short muscles. And then if you just go across her body to her abdomen, the abdomen is going to have locked long muscles. Notice the relationship from front to back of the body and from top to bottom. These relationships are predictable, and we can see, for example, that her upper back is locked long and her chest is locked short. So we have one long, one short. And we can see that her upper back is long and lower back is short. And then flipped, or kind of the opposite, is that the chest is short and the abdomen is long. So this makes things fairly predictable. We can see these relationships not just on this plane. Our view here is the sagittal plane. It kind of cuts the body in half from left to right. But we also see it on the frontal plane, for example. We're not going to be looking at that today, but there are very predictable ways to see the posture and kind of have a good idea of what the muscles are doing in other parts of the body. This symbol might look really familiar to you. This is an ancient representation of Tai Chi or Yin Yang. Both are correct. And what this is a concept of interrelationship in some way or form. It's a concept of a duality, but the duality is not always equal. It's always changing. It's always consuming the other side or supplementing the other side. One way that we can read this is if you were to put your finger on the periphery of the circle and draw a clockwise circle around it. So just draw your finger from the top, from 12 noon, and then go clockwise. You'll notice that at some point, the black changes to white and the white changes to black. But not only that, there's a very small amount of black within a large amount of white, and then the black increases and it becomes the utmost amount of black, and then the white starts to show, and then as the white increases, the black decreases, and then it turns back into black, and so on and so forth. This is how yin-yang are supposed to flow. What we see in the body is the same thing, but also we see yin consuming yang and yang consuming yin. And usually when there's too much yang, there may be a small amount of yin, or if there's too much yin, there may be a small amount of yang. I bring this example up because in the previous case where we had the excess kyphosis and the excess lordosis, we can think of each side of the body and each portion of the body, top and bottom, as having some aspect of yin consuming yang or yang consuming yin. This can be kind of a complex subject, so let me make it a little bit more simple. The muscles on the locked long side are weak. This can be, for example, a representation of yin. The muscles on the locked short side are too strong. So this can almost be a representation of excess yang if we're just thinking about comparisons. So the locked short is excess and locked long is deficient. So then we see a deficiency in the upper back, an excess in the chest, a deficiency in the abdomen, and an excess in the lower back. I often use these concepts of excess and deficiency to treat this posture. So I can use an acupuncture needle to stimulate the motor point nerve innervation of the muscles that are deficient. For example, you have the middle trapezius and the upper trapezius. They're stretched very long on the upper back, and by stimulating the motor points, it kind of activates that muscle to start again. But if it's the pec minor, which exists on the front of the chest, that is too locked short, and it's actually not allowing those trapezius muscles to initiate and activate, it's actually inhibiting the muscles, then what I can do with the acupuncture needle is I can stimulate the muscle in a way that it will release. So this concept of excess and deficiency is actually quite clinically relevant too, and that's why I share it with you. This is one of the key things that I look at when assessing people's posture. This is called hip tilt. The left picture shows anterior hip tilt, and the right picture shows posterior hip tilt. And sometimes you'll have a variation of these. For example, you'll have on the right side anterior tilt, on the left side posterior tilt, or vice versa. Or you might have bilateral anterior tilt, but one side is more interior, or you might have bilateral posterior tilt, but one side is more posterior. But with this, we can really see the muscular relationships. For the previous example, that image, that person had anterior tilt, and we can see that the abdomen of the left picture is protruded. We can also see that the low back is especially curved. The muscles that are out of balance, or at least a couple of them, are the erector spinae, or the low back muscles. They're tight. The iliopsoas is actually a hip flexor, which means that it brings the leg up to the abdomen. That's also tight. In the right picture, the posterior tilt, it's the opposite. So the low back is actually locked long, and what is tight is the glutes, the glute maximus, and the hamstrings. And the abdominal muscles, the rectus abdominis, are also tight. These two postural findings tell me a lot about people, and both of these people could have low back pain potentially. One on the left, perhaps because the muscles of the back are too tight. You can see how close the vertebrae are to each other. And the one on the right, you can see that, well, the vertebrae are nice and spaced out, but the muscles of the back are still most likely quite tight, and you'll have possibly pain in the sacral area, or you might have pain because it is compressing some nerves, but it's due to the locked long muscles, not locked short. So both of these can show as low back pain, but we would have to look at other findings to see exactly why. We often see this anterior hip tilt or increased lordosis in people who are overweight. You can see in the top picture that someone with a large gut, it will naturally bring the hips into an anterior tilt. And as you can imagine, the same thing with pregnant women who are in the later stages of pregnancy. You'll have a severe anterior hip tilt. It can happen with dancers. I see it a lot in dancers, but also just in people who are just sitting at the desk all day. The shoulders will be hunched, and the abdomen will kind of weaken, and the hips will shift forward. That's very common. And to give you a little bit better picture, Donald Duck has an anterior hip tilt. I mean, look how forward his lower body is, and he's kind of a perfect example of that hyperlordotic curve. So what issues might you have? You might have low back pain. That's what we've been talking about. Weak digestive system. That's kind of interesting, right? It could be because you have that larger gut, or it could also be because the nerves that actually come out of the spinal column in the low back partially innervate the organs of the digestive tract, and those are being compressed a little bit with this posture. Of course, sciatica, that can happen if you have that herniated disc that comes out of those lower lumbar and sacral foramen. So that's very common. Urinary difficulty, again, the nerves that exit out of these lumbar vertebrae innervate the bladder, and this is especially for kind of the lower lumbar and the sacrum. Constipation, the same reason. Difficulty breathing. Can you guess why? Because often when someone has that hyperlordosis, they have hyperkyphosis, and the upper back will actually be locked long, and the shoulders will fall forward, and the whole chest will be compressed. This is a perfect example of that, the hunchback posture. The hunchback posture goes perfectly with the anterior hip tilt. So when the low back muscles are shortened, the chest muscles are often shortened as well. The ability to take a full breath is inhibited. Look at this x-ray. You can see that the rib cage is actually going to be compressed together as that hunchback exists and as the shoulders fall forward. What's another posture that might represent as the hunchback or hyperkyphosis? Yeah, it's texting. So, how well do you think these kids can take a full breath standing like this? Probably not very well, right? Posture can be and is often related or correlated to a dysfunction of the internal body as well, believe it or not. And we think about this all the time in Chinese medicine. So, going back to this posture we've been looking at with the hyperlordosis, hyperkyphosis, one pattern that we can see with this is the pattern of liver qi stagnation and lung qi deficiency, or liver insulting the lungs. Now here we're talking about the Chinese medicine liver system and the Chinese medicine lung system, which includes the function of the organ itself, plus related functions that we kind of designate to the organ, plus the channel. Remember, there's actually 12 channels in the body relating to 12 organs. 6 on the legs, 3 yin, 3 yang, and 6 on the arms, 3 yin, 3 yang. So the liver system has a function of smoothly coursing qi in the body. And what this means is all physiological movement-related actions are influenced by the liver system in Chinese medicine. We often see this as a manifestation of pathology rather than physiology. For example, nausea is a result, or can be a result, of the liver overacting on the stomach due to emotional upset. So here let's trace the liver channel. So it actually goes from the top of the foot, where you can't see in this picture, and it comes up the inside of the leg, wraps around the groin. It comes into the liver itself, crosses the diaphragm, up through the lungs, into the neck, and then up through the vertex of the head. As the liver channel passes through the diaphragm, it also traverses the scalenes. You can see this in the picture. The scalenes attach from the clavicle, which is at the top of the picture there, to the transverse processes of the vertebrae C5 through C7. That's not in the picture, but just to give you an idea, that is about the bottom part of your neck. So when these muscles are locked short or in excessive kyphosis, they bring the head forward. Where have we seen this before? This is in that hunchback position. This is caused by the anterior hip tilt. So this dual pattern with this posture will often manifest as shallow breathing and frequent sighing. That's easy to see now that we know that the liver channel passes through the diaphragm and the scalenes, which are both accessory muscles for breathing. It manifests as frequent colds or sinusitis. Again, the liver channel and the lung channel pass around the nasal area, being easily fatigued, which is common with when you can't breathe very well. Possibly a weak voice, and irritability and melancholy. These are classic symptoms of liver qi stagnation. And for women, there's often menstrual irregularities. This is another common symptom for liver pathology. When a patient is involved with excessive emotional stress or eats a lot of sugar, consumes a lot of caffeine or alcohol, all of which can stagnate the liver system's function, combined with poor posture and some of the previously mentioned symptoms, we can diagnose the true source of the issues and treat it. I hope it's clear now that you can see through this holistic vantage point that no one thing in the body is happening by itself. So, for example, posture is often related to the internal happenings of the body, and posture can also affect the internal happenings of the body. The environment, what we eat, what we drink, how we feel, it's really all related. And once we're aware of that, it's much more clear on how we can pick apart little aspects of what's happening to you and treat them effectively. So the point of this PowerPoint was not to scare you, but let you know that there are ways we can help. The best ways that I've found is a combination of postural corrective exercises, acupuncture, myofascial work, and even custom Chinese herbal formulations, which really works on that internal aspect of all of this. I really do believe, whether the issue is acute or chronic, that we can get back to allowing the body to move the way it really wants to. Thank you so much for giving me your time. If this information interests you, you can contact me at 619-618-9936. My phone number is listed right here. My email is dr.callisonih@gmail.com. That stands for Dr. Callison Integrative Health. And I'm located right at Inner Spring, which I know many of you have been to, if not all of you. I very much look forward to hearing from you if you feel like this is going to be helpful for you. And thank you again for your time. Goodbye.